And Dr. Emer, you're live from New York.
Hey guys, live from Manhattan. We're doing one of the newest lasers on the block, Moxi. This is the new light resurfacing laser by Sciton. We just did BBL Hero, which again is another one of the new light treatments. Hero standing for high energy, rapid output, very quick bulk bursts of energy in a very fast time period, literally no downtime required. The redness she has is from a little rosacea that we're bringing out from the
Shows the handpiece.
And now we're working on with the Moxi. I love this laser. This is a 1927. Take a look. It's so light. It reminds you of Halo, you guys, but it's not nearly as much downtime. This is very light resurfacing for those who have sensitive skin types with rosacea, the acne, anyone that wants minimal downtime, but we want to boost their results. It's similar to some other lighter resurfacing lasers. You can see we've already done the forehead, and there's little teeny dots that go into the skin, and those will lightly resurface. The cool thing about this is it's just really light and safe. It's gonna help melasma, it's gonna help rosacea, fine wrinkles, and it has minimal downtime. I love to combine this with the BBL Hero or the Forever Young BBL, so we can get improvement in both texture and color. And with rosacea, you actually do need a little bit of resurfacing, you guys. So
does Moxi get rid of scars?
Moxi can be a light version for scars, but Halo's really the gold standard for scars, you guys, in terms of resurfacing. So for this patient here, we're doing very light, and that's why we're doing the Moxi over doing the Halo, because I don't want her to have a lot of downtime. This is for a light treatment. Beautiful. And you guys could see minimal percentage. We're working on about 10% of the surface area in density. We're working about 10 millijoules, which is super light, about 1,000 microns in depth. And this is just super light so that she can actually do treatments and not feel like she had too much done.
Miss Tiny said, oh my God, I love him.
I love you.
He's assumed he's a surgeon. He's a dermatologist, but he does do HC lipo.
Dermatologist. I do a lot of lipo, a lot of lasers. I love gadgets. You guys could see here, I mean, we really were able to already get that rosacea, and now we're working with the Moxi.
And for those that just tuned in, they're asking, what is this? This is for rosacea. This is
the
laser.
new Moxi for texture and color, but it also can be used on my patient right now who has rosacea, because we're doing a very light treatment. Now what she's going to notice additionally, a lot of these brown spots are going to come up and improve. And again, we're doing very low percentage, very low depth. Perfect.
Hello, Dr. Emer. I'm from LA. I was your patient 3 years ago, and I'm thinking about getting a six-pack surgery soon.
Oh, let's do it. Come see us. Why wait 3 years? I can't believe that you waited that long to come see us. Most of my patients stay consistent. Now we're working on the nose. So come in, appointments at chasenemermd.com. We also do skincare at emeragecosmetics.com. And she's doing amazing, you guys. Like literally, I'm working on her pores.
What's the downtime for this?
The downtime for this will just be a couple days of light redness and peeling, but I'm going to do something very special right now that very few people see.
Hey, Alexander, what he's doing is he's using a laser called Moxi because this patient has rosacea. So I don't know if you can see her skin.
So just so you guys know, this is called micro-ampoule infusion. This is a little microneedling device that now puts PRP, Botox, fillers. No, I would keep doing that, Gene, just to cool her down, into the skin, and this helps the rosacea dramatically. So I like to do this right after the laser.
So that has little needles right at the very tip.
Little baby needles on here. You guys could see between 0.3 and 0.6 in depth.
What's the cocktail in there?
And I cannot give away
the secrets.
The special sauce, you guys. Dr. Emer's special sauce. However,
but what does it do?
It has in it vitamins, Botox, fillers. It has in it PRP. This is going, you see, when you press down, you see those needles? You can see that product comes out, you see? So that product goes right onto the skin. And this is gonna help her not only heal faster, but this is also gonna help her rosacea. This is gonna make her rosacea go down.
Now, why is it important to have, you know, consistent skincare or to come get lasers like this consistently?
So you guys know, to make your skin better, it's like exercise. You always have to be working on it. And if you stop, you go back to that aging, normal aging process. So we really need, in general, you really need to be doing things consistently. And so my patient here today that I talked to her about the fact that her rosacea is going to be a lifelong treatment plan, but the first few treatments she's going to get big improvement, and from there we maintain. So,
hello BH, hello Orvella, hello
take this off a
Mirios.
second, hold on, just so I can get close.
Oh my god, I need this for my rosacea. When will you be back in New York City? I need to schedule.
Come on
I'm in
Monday.
Montreal.
We're here till Monday, but we will be back in 2 months, most likely in January, 2 to 3 months. But you guys see, look at that little liquid that's going on to the skin. You see it? Look at that. That little dewdrops right there. All of that is our beautiful cocktail of product that is going to help her skin. The other very important thing, Jean's doing it right now, is cooling. It's very important after lasers to cool the skin down, because that allows the swelling to decrease. Look at all that product, guys. See? This is gonna make her rosacea so much better. In some instances, people think this hurts more actually than the laser itself. So we just wipe this all across and we just keep on going.
Do you numb the skin before the treatment?
Oh yeah, this is all numbed. And she's doing great, very minimal. I just really want to get this product, because remember, after you laser, the skin is open, the channels are ready to accept this Botox and this filler. So,
Hey REDNESS, so here's the thing about pricing. Here, you never do, it's not a one-stop shop where everything's the same. Everything has to be tailored to the individual.
and
So,
it's combined, so the combination is different than the independent treatments alone. So you guys see, look, we're working now.
and again, for those that just tuned in, what laser did she use?
So we just did the new baby on the block, Moxi. This is our new resurfacing laser for all skin types, super light skin tone, or super light treatment for all skin types. Anyone that's looking for mild resurfacing, like her, who wants improvement, but she's got rosacea. We want to calm that rosacea down, but we also want to make her just look better. Couple treatments of Moxi and BBL, which we just did. And she will do really great.
Skincare.
We're going to use Emerage Skin, especially the Hyla B and the Refit Face afterwards. Will really help her heal. My growth factor and peptide serum, Refit Face, you guys, was designed post-laser to really help redness. It helps rosacea as well. Again, I'm just pushing this product into the skin. Now, what I like to do, after I've already done a lot of the resurfacing, is now I take, because now all the needling has been done, we take little bits of this and we just wipe this in, because this is going to be the special cocktail, which is going to really help overall texture.
Will you use
and
this serum without
healing.
laser?
What?
Will you use this serum without laser?
Yes, you can, because it's got those needles on it, remember. So I really don't want, this is a very important treatment, but you don't need to keep needling over and over onto the skin.
Yes, she is red because she just did a laser, so it's a little sensitive right now. And we did some cocktail that had a little bit of needles.
Yeah, so our cocktail sauce right here. Now the other thing we're gonna do, and I'm gonna give her some of this to take home, is what we call PRP.
Now,
Yeah.
does this hurt?
This, did it hurt? Did it hurt her? Did you have, no.
No.
She said no. She's a strong woman, superwoman right here. So now we're putting a little PRP. This is her blood plasma. Now I like to put a little bit on right now, and then a little bit she takes home and does that with a mask. So we're gonna put that on with a cooling mask. We're gonna keep infusing this into the skin. This is gonna help her heal. I did a lot of the initial studies showing that this will help healing, and she's gonna do great. So that's really it, you guys. This is BBL Hero plus Moxi, the newest tailored combination for just overall rejuvenation, but for her specifically, we're working on this terrible rosacea that developed for her. Within a few treatments, it's going to be significantly improved. And now we've infused all her growth factors on here.
What kind of cooling mask? Are you going to use a mask?
We're going to put a biocellulose mask on right now. This is going to help her cool and infuse. And then I'm going to give her, the most important part, you guys, is putting this mask on and then cooling immediately after, because this mask is now going to infuse the product into her skin. So we're going to give her that tube, Jean. You can let her hold that in her hand. I'm going to give her that tube. I'm going to have her hold, perfect. Hold this to your face. There you go. Get nice and cold. And that's what we need. 5 to 10 minutes of nice cooling.
Can you come visit it?
Press this right on all the skin so she gets nice and cold. I want this to infuse the PRP and help the laser channels heal. Great. So that is Moxi BBL, micro-ampoule infusion and PRP for rosacea and overall facial rejuvenation. Bye, guys. Perfect. All right. So just tell her to